My name is Alicia Kirchgessner. My final presentation is HIM roles in revenue cycle management for class HIM 5363.0001 and Professor Jacqueline M. HIM professionals help build the gap between the operational side of healthcare and the increasing demand for patient-centered care. HIM professionals play a pivotal role in both clinical and operational efficiency. We will examine some of the ways HIM professionals contribute to revenue cycle management. We will discuss the 5 objects that make HIM professionals vital. Those objectives are going to be the HIM team oversees the flow of patient care, documentation, making sure all documentation is accurate, accessibility and security, and building teams that enhance patient flow. The first objective is patient flow. You may ask yourself, what exactly is patient flow? So the flow of patient care describes how the patient moves through the healthcare facility from arrival to discharge. If the patient care is poor, it creates problems. If the patient flow is poor, it can lead to several problems. Here we see charts showing what happens when the patient flow is poor. It can lead to overcrowded waiting rooms, which leads to unhappy patients and wasted resources. Another side effect of poor patient flow leads to the medical staff being stressed, which can cause medical errors that can harm the patient. And here we can see our chart, the poor patient flow, which causes waiting room overcrowdedness, which can lead to unhappy patients and wasted resources. And then we also see where our medical staff is stressed, which can cause medical errors. When the patient flow is dependable, it helps keep the flow moving smoothly. To run smoothly, an HIM professional needs to have sharp organizational skills, which allow them to monitor patient locations and monitor patient movements. They also need to have a cool head for decision making. So they would need to have experience tracking hospital beds and understanding level of emergencies. They will also need to understand patient transfers. So they will need to know the patient transfer rules, and they will need to know the patient transfer requirements. Correct documentation is vital for HIM professionals to ensure that patient health information and records are complete and accurate. They are the link between clinicians, administrators, technology designers, operations, and information technology professionals. So here we can see all the ways that HIM professionals are linked throughout the revenue cycle process. So as you can see, HIM, health information management, is crucial through the entire revenue process. We have clinicians, we have administrators, we have operations, and we have IT professionals. So HIM is vital through every aspect of that revenue cycle process. As HIM professionals, we secure a wide range of patient data, from personal contact information to medical history and payment records. We must follow HIPAA compliance to ensure that patient data is secure. So that includes supporting HIPAA compliance, enforcing policies, and safeguarding patient information. There are a lot of ways for us to follow HIPAA compliance, but some of the most important ways are encryption standard, data access controls, breach procedures, protect patient privacy, and fostering trust. If we do not have the trust of our patients for us to be able to care for them, then they are not going to want to come back to our facility. So we must ensure that we are fostering that trust along with that HIPAA compliance by following all of the guidelines. As HIM professionals, we aim to build teams that enhance patient flow. These are just a few examples of how we can achieve that. Setting clear goals and expectations enables all tasks to be completed efficiently. It eliminates the need for HIM professionals to do double the work. Using data to guide decisions enable HIM professionals to analyze the data and identify the causes of long waiting times, ultimately helping to reduce them. When hiring, we must prioritize skills over credentials. While some departments may require credentials, we must also ensure that they possess the skills needed to complete that task. Turning problems into improvements, we can use our previous process of using data to guide decisions to be able to help turn our problems into improvements. And invest professional development for existing talent. So while we may need to hire new talent with those credentials, we also need to remember that we do have existing talent that is able to do that job that they were hired for. So we must also make sure that they are getting that requirement training for the updated training processes. Anytime there is an updated HIPAA update, they must be trained on that. So we need to make sure that they are still up to date on all of those on all of the existing and new protocols. And here we see our references that we use to be able to get this information that is needed for HIM management to show that they are vital in the revenue cycle process.